Vegetarianism Part 2, Nutritional Concerns. Deficiencies among vegetarians are most likely to be observed among vegans. The key is to consume a variety of foods and the right amount of foods to meet your calorie needs. The dietary guidelines and My Plate should be used in planning vegetarian diets. Now let's talk about the risks of poorly planned vegetarian diets. Slow or stunted growth in children. Protein deficiency. Iron deficiency anemia. Zinc deficiency. Osteoporosis, especially in older adults. Rickets in children due to a vitamin D deficiency. Pernicious anemia, which is a vitamin B12 deficiency, and a possible riboflavin deficiency. Pregnancy and breastfeeding. All well-planned vegetarian diets, including vegan, are appropriate for all stages of the life cycle, including pregnancy. A prenatal vitamin is recommended for most pregnant women, vegetarian or otherwise. Bottom line, you can have a healthy pregnancy being a vegetarian and being a vegan. Older adults. Older adults may have difficulty obtaining sufficient calories and adequate amounts of calcium, vitamins D, and B12. And this again is primarily due to the high fiber, which may fill them up. And older adults, especially women, are at risk for osteoporosis due to low intakes of calcium and vitamin D. This occurs in women who are not even vegetarian, but vegetarian older adults really need to make sure that they get enough calcium and vitamin D. Furthermore, many older adults do not get enough sunlight for their bodies to produce a recommended amount of vitamin D. And of course, some of them may be scared of getting skin cancer, but a healthy amount of sunlight for about 15 minutes a day, hands and face exposed, is recommended to get some degree of vitamin D. It is important to note that vitamin B12 absorption decreases with aging. And so a vitamin and mineral supplement is recommended for older adults. Infants and children. Vegetarian diets can satisfy the needs of infants, children, and teens. So nutritional needs can be satisfied for these groups. During infancy and childhood, adequate calories are needed for growth and development. This is not usually a problem for infants because they rely primarily on breast milk or infant formula. However, during childhood and the teen years, vegetarian diets should consist of high-calorie, high-nutrient foods. Again, because many plant foods are low in calories and high in fiber, it's easy for the child or teen to feel full before consuming adequate amounts of calories. Quality sources of protein must be emphasized, and moderate amounts of high-fat foods can help to increase calorie intake for children and teens. It is also important to provide in-between meal snacks, as they can help to boost needed calories. Junk food intake should still be monitored. Again, you can be a vegetarian but have a horrible diet and just eat a lot of junk food, especially with teens. Yes, potato chips are vegetarian. Cheetos are vegetarian. So we have to still monitor the junk food intake for children and teens. Vegan children and teens need adequate vitamin B12, vitamin D supplement, or fortified foods if sun exposure is limited, foods rich in calcium, iron, and zinc, frequent meals and snacks, adequate calories and fat, and a vitamin mineral supplement may be needed.